Hey there, welcome back to the Dr. Terri Show. I'm your host, Terri DeNeui, and today's episode is one you're going to want to listen to all the way through, especially if you've ever considered plastic surgery, struggled with body image, or felt pressured by today's impossible beauty standards. I'm joined by the incredibly skilled and compassionate Dr. Lindsay Tavakolian, a board-certified plastic and reconstructive surgeon who approaches aesthetics through a functional, patient-centered lens. She's not here to sell you a transformation. She's here to talk about what's actually driving the desire for change and how to do it safely, intentionally, and without losing yourself in the process. So if you've ever asked, should I get a mommy makeover? How do I know if surgery is right for me? Can I trust my surgeon to have my best interests in mind? This episode will help you answer those questions with confidence. Here's what you're going to learn: how to prepare your body before surgery to reduce inflammation, support healing, and improve your long-term results, especially if you've been on the GLP-1 medications and have had some rapid weight loss. What to look for when choosing a plastic surgeon and the red flags to watch for. The real meaning of a mommy makeover and what procedures are involved, and why some post-surgery complications aren't surgical at all and may point to deeper health issues. The connection between gut health, detox pathways, and surgical recovery are going to be talked about, and why beauty trends are making everyone look the same, and how to protect your individuality in a filtered world. This conversation pulls no punches, and Dr. Lindsay is honest, grounded, and deeply thoughtful about the privilege and responsibility of performing aesthetic surgery. She'll want you to understand why you want the procedure, how to do it safely, and what you need to know before making that decision. If you want to feel more confident in your body, whether that includes surgery or not, this episode will give you the clarity and insight you need to make an empowered, informed choice. Let's get into it. Here's my powerful conversation with Dr. Lindsay Tavakolian. Dr. Lindsay, thank you for being here. I'm really excited to have you on, because we've never had a plastic surgeon on, and I think it's just such a great conversation. And you approach things a little bit differently, and I loved getting to know you and having some conversations a couple of weeks ago, and just getting to know your approach to your work and what you do. I know that you must be a very good surgeon because Dr. Heistine, who's been a friend for a very long time, is, as we talked about, he's pretty particular about who he works with, and he's quite proud of having you join him. So it's an honor to have you here.
I'm honored to be here.
Yeah.
Thank you.
Thanks. So, gosh, there's so much we can talk about. I think that there's a lot of questions around surgery, plastic surgery, around safety, around outcomes, around how do I find the right person? What should I look for? And I have patients come in my office quite often asking me these same things. Who do you trust, and how should I shop for a doctor? And my advice is generally, you have to visit and have a few consults with different people, and you're gonna know who you're vibing with, right? And if you have any kind of reservation, so what do you say about that?
Well, one thing that I love about plastic surgery and my profession is that oftentimes I attract patients who are similar to me.
Yeah.
And so that's kind of what you want when you're looking for a relationship with a surgeon. You want somebody who does have your vibe, who has the same goals, who has the same mindset, or if they don't have the exact same approach that you do, at least listens to you and wants to know what your goals are so that they can meet you at your goals. Because the conversations that I have with patients on a daily basis from one clinic to the next clinic patient can be very different. And it's because different women come to me with different goals. So this could be a young woman coming to me saying, I'm very excited and passionate about having bigger breasts because I think it will increase my confidence. The next person in that clinic could be somebody who says, I've had bigger breasts. They're really in the way. Functionally, I'd like to have smaller breasts, or I like a small breast aesthetic.
Right.
So how we mesh and how we come up with a surgical plan is patient-led and patient-directed.
All right, that's great.
So my advice when you're in a consultation with a surgeon is to make sure that they're not just spitting out what they want you to hear,
right,
but they're listening to you and saying, this is what I know from an evidence-based practice. These are safe procedures, but what do you want and what are your goals?
That's good.
And then the perfect consultation is when you can marry a physician who educates you in why your goals may be good or bad, and then helps you either decide that surgery is right for you, wrong for you, or if it was a different surgery than what you were thinking, that'll help you meet your goals.
Yeah, I love that. And I love what you know, just talking about building that relationship, because it's typically not a one and done thing. I mean, typically, wouldn't you say you have this relationship with this patient over the course of, you know, their
decades,
age-related changes, you know, all of those kinds of things, you know, that start. And then, you know, I heard somebody give another friend advice one time. It's like, you'll really know when you walk in their office if all of the office staff looks the same. That's probably maybe a red flag. I don't know, unless they all look really great.
Right.
But I thought of that because you said, you know, you want to make sure that that surgeon is meeting you where you're at and looking at your goals and not just making you another version of what they do typically, right?
Right.
Yeah.
And another thing that I emphasize is keeping people's natural look and their natural inherent value in their own attractiveness.
Absolutely.
And I don't mean conventional attractiveness. I can sit here and I can draw you diagrams of all the measurements that contribute to what's considered attractive. But in reality, when you think of the people that you know and you think of people that you consider attractive, it's because they have unique qualities, and it may be a slightly crooked nose or asymmetry of the eyebrows, but there's this thing that just gets you about them and endears you to them. And
That's
so
good.
I think one of the downfalls of aesthetics currently is to overdo or kind of make people look similar to each other.
Right.
In fact, Pamela Anderson just had a quote out this week. She's been in the news a lot for doing things a little bit differently with her care. And she said that she thinks everybody's starting to look boring because they all look similar.
Everybody looks the same.
And I've been saying this for years, that we are going to see an evolution in the aesthetic industry of people trying to go back to looking like them.
Right.
And so this is the core of the way that I treat people. I love to enhance. I love to rejuvenate. I love to lift. I like to take away extra skin. I like to make you look younger, but I don't like to change your inherent look.
Yeah, I
so
love that.
it takes away that it factor for you.
That is so good. And I had a patient one time that years and years ago went to a plastic surgeon to just have kind of a mommy makeover. And I want to talk about what that means to you. And so she, you know, had her breasts done and her tummy tuck, and she didn't want to change her shape. Like she knew if she lost another 10 or 15 pounds, her legs and thighs and all of her lower half would be the way, you know, she wanted him to. But he convinced her to let him do some liposuction.
Okay.
And she was so disappointed because she said, I like my hourglass. Don't make me look like a boy. Don't make me straight, because everyone in his office was straight and he made her straight. And she was so disappointed because it's done, you know? And so it's so important that you have a very solid expectations and goals with your plastic surgeon. I love that. So I want to talk about the mommy makeover because this is a term that, you know, a lot of people might not know what that means, and I would imagine it means something different for everyone. But what does that mean to you?
So classically, a mommy makeover is a woman who's wanting rejuvenation for changes that come after having children, after going through pregnancy. And this can actually be applied to women who have just had weight gain and weight loss too, even if they've never conceived. But it's changes that come with an expanding abdomen and then the loss of weight or the birth of a child. And so let's talk about the tummy first. What do we do for the tummy? Well, you can diet, you can exercise, you can, you can move towards overall health and wellness. But if you have extra skin, or if you have laxity of your abdominal wall after having children, you can maximize your physical therapy, which I recommend after childbirth. But you get to a point where there's extra skin and there's contour problems that cannot be addressed through lifestyle or physical therapy.
Right.
And so for the tummy, we usually do a tummy tuck. That's removal of extra skin. And one of the benefits of a tummy tuck is that not only are you creating a flatter tummy and a tighter abdominal wall, but you're also taking away the lower portion of the abdomen surgically. And oftentimes that bears a lot of the stretch marks.
Yeah.
And so you get a lot of your stretch marks cut out.
Yeah, that's a good thought.
Which is great. This can also be combined with some liposuction. The way that I like to use liposuction with a tummy tuck is to kind of bring the love handles area down and just to create a nice contour around the waist.
Yeah, that's nice.
So that's the tummy portion. Now, breast change a lot with pregnancy. You have all the hormones in pregnancy, and then you have the come down from that after you're done breastfeeding. And your breasts oftentimes go from being, whether they're small or big, they often go from being perky to being lower on your chest. And a lot of women equate it to being like a ball inside of a sock. You have this breast tissue kind of moving around this empty sac, and it really ages how a woman feels about herself. She can be 30 years old, 35 years old, and she can feel like she's 60.
Yeah.
So what do we do for the breast surgically? Well, we want to lift it, put it back higher up on the chest where it was before. And sometimes women want to add an implant to restore some volume that they lost. But women will also sometimes opt to just do the lift and keep their own tissue and not have an implant. And we can do it either of those ways and still improve the contour of the breast beautifully.
Well, let's talk about implants because, back, several decades ago, it was all silicone was bad and then it was all saline. But now, obviously, because of some, the trials, the safety trials that I think that went through, silicone implants have made a resurgence over the past decade, I would say.
Yes.
So talk about that because a lot of people may be afraid of it, may be afraid of this foreign tissue and all of that. So what do you say about that?
Right. So this is another topic where I think it's very important to meet your patients where they are. And so I just want to emphasize that I'm going to give you some data next about breast implants, but I also work with women and do surgery on women who do not believe that implants are right for their body. And I wholly support them in their journey, and I can do safe surgery for them. So how, as a physician practicing evidence-based care, do I approach the conversations around silicone implants? Well, one, I tell my patients that they were actually taken off the market for over 15 years in order to look at the safety. And they were put back on the market because the medical communities found that they were safe, and there was no evidence to support an association between breast implants and systemic illness. So they come back on the market, and then you have the advent of social media. Well, then there was this new wave of education on social media where women started talking about it again. And so the Aesthetic Society is really wonderful and has extraordinary leaders, and thought, we need some updated evidence. We need some updated studies to help take care of this body of women that exists that think that they have systemic symptoms from breast implants. So they basically, over the last 5 years, have updated some of the science behind how we treat women who believe that they have systemic illness from breast implants. And they did most of these studies by doing biopsies on breasts that had never been exposed to a breast implant, and then biopsies on breasts that had been exposed to a breast implant in that woman before. And I tell my patients that the bottom line of all the new updated research is that there's still no evidence that breast implants are associated with causation of systemic illness. However, women who believe that they have systemic symptoms from breast implants sometimes will feel better once they are removed. How do we know which women those are? We cannot predict that. There's so many determinants of health in our environment, in our bodies, from genetics, whether it's built into our genetic code or it's from the food we're eating.
Let's talk about that.
So we can't say, if I take these breast implants out of you, you're going to feel better. You may not.
Yeah.
Which brings me to the next thing. If you're wanting to take your breast implants out, even though there's no hard scientific evidence that they're causing problems, then let's take them out. But how do we do that safely?
Yes.
There's really two approaches to this. There are predatory surgeons who realize that this is a vulnerable group of women, and they fearmonger them, and they jack their prices up really high.
I've seen that. Mm-hmm.
And they also recommend things that are not evidence-based. And they tell women they must have a full en-bloc total capsulectomy in order to feel better after surgery. And so I want to bring you back to our new research. Well, one of the things we wanted to answer in this research was, does it matter in these women if you take part of the capsule, all of the capsule, or none of the capsule out when you're removing that breast implant? And the gist of the bottom line is that the women who were going to feel better after their breast implants were out, it did not matter if they had the full capsule, partial, or total.
Okay.
So why does this matter for safety? Taking the entire capsule out can be dangerous to the woman for a few reasons. One, it can be really hard on the breast tissue itself, which may not be dangerous, but it can leave the breast that you have a little distorted and a little unhealthy.
I would imagine so.
But the posterior part of your implant capsule is on your chest wall, and that effaces with your ribs, with your intercostal muscles. Now imagine surgically taking that off. Yeah. So we're dealing with structures that are just above the lung, and it puts you at risk for a pneumothorax. And so in general, if the breast capsule is stuck to that posterior wall, you want to leave it alone to protect the safety of the patient. You want to maximize the benefits of the surgery, minimize the risks of the surgery, and get your patient through that surgery safely. Yeah. And so I tell my patients, whatever capsule is available to me to remove, if it appears unhealthy, I will remove it.
Yeah, that makes sense.
But if it puts you at risk, then I won't remove it and I'll leave it behind. And the data supports that it should not affect whether or not you feel better with your breast implants out.
Yeah, that's good. I'm really glad you talked about that because it did get really trendy on social media to, you know, all these women taking out their implants. And I actually had a patient that she struggled with a lot of, you know, weird symptoms, and she had done all the research and she had decided it was probably her breast implants. And so she did go have the surgery, had them out. And probably for about a month or two, she felt better, but everything is the same again, you know? So I just, you know, I encouraged her to, we did a lot of work from a functional medicine perspective, and let's look at your gut, let's look at your diet, let's look at food sensitivities, let's look at, you know, she lives on a farm and chemicals and pesticides. I'm like, there's so many things and that caused a toxic burden in her. And we really worked really hard on getting to the root cause and looking at what toxic load are you carrying that we can help detox you from. Yes. And that's been the biggest thing that has helped her tremendously. So I do think, for me, my advice to patients, because of especially the new data that you're talking about, is let's look at some other systemic causes first, because 9 times out of 10, we are so toxically burdened in this country. It's probably something that you have a toxic load that needs to be purged. So I love that you had that we talked about that, because that is a question mark for a lot of women. I have one young woman that I spoke to this exact thing. She's not feeling bad. She's not feeling anything, but she's gotten caught up in the social stuff. Yes. And is talking about wanting to get her implants out. They haven't even been in that long. And I'm like, oh, okay, well, you might want to really. So this is good. Hopefully she'll listen to this. I'll send her a link to this podcast.
Well, I'd love to share a story from one of my patients. I had a patient come to me who had breast implants put in by somebody else. And then she also thought that she had breast implant illness. And so she had them taken out. She comes to me years later and shares her story with me, and she wants implants put back in. She says, I had the implants taken out. I did not feel better at all. I went on a health and wellness journey, and I lost 40 pounds. I started eating healthy. I stopped eating Doritos. And what do you know? All of her symptoms went away after she did this overhaul of her diet and exercise. And so she came back and said, I don't think for me it was the implants. I think it was my poor diet. That being said, I have had patients who are absolutely lovely who do think that they feel better after taking their implants out.
Yeah.
And my stance as a woman and a plastic surgeon is that as a woman, I'm here to advocate for you. So if you want to treat your implants almost like an elimination diet and just take them out of the picture, then that's absolutely your prerogative. And it's not a bad thing to do if you just want to start eliminating possible sources of problems for you.
Yeah. And see what happens. That's great. Gosh, there's so much to talk about. Well, before we move on from the mommy makeover, I want to talk about something that's real. I get questions on this probably weekly, is all of this amazing but rapid weight loss from the GLP-1 receptor agonists.
Yes.
And I mean, yes, those have been a game changer. I think, I've talked about the GLP-1s in many shows with many different clinicians, and I really believe there's a lot of clinicians out there that are doing this right, and I think there's a lot that are doing it wrong. And unfortunately, there's a lot of clinicians that are prescribing them this, like the allopathic model, and just to lose weight with really not paying attention and helping that patient develop lifestyle changes, make sure they have enough protein, make sure they're not losing muscle, make sure their hormones are optimized, because that makes a difference as well. But one of the things that patients are obviously having a problem with is the skin laxity that comes with this rapid weight loss. And, I've had patients ask me about thigh lifts, and maybe that's all it is. It's skin laxity on the inner thigh and maybe a little bit on the arms. To me, I'm like, well, maybe beef up the muscles in the arms and maybe that'll stretch that back out. I don't know. But are you guys seeing a lot of that or doing much of that? Or,
yes, it's very much on the rise. Yeah. It is not a new phenomenon to us because previously it was bariatric surgery.
Right.
But now with GLP drugs, it's incredible that people have access to this without having to undergo surgery.
Right.
And it's a really exciting front. And like you said, there's a good way to do it and a bad way to do it. But people who lose weight fast and large amounts of weight will undoubtedly have excess skin.
Right.
So the answer for it is surgery.
Yeah.
There's only a certain amount of muscle that you can build. And I do have patients that kind of maximized their own growth with muscle building, and then they still have laxity. So common surgeries that I do, we'll start at the top. Facelifts. People are getting facelifts at a younger age because they're seeing those changes in their neck frequently that you normally see at an older age, but you see really fast after weight loss.
Absolutely.
So facelifts, neck lifts, and then we move down breast lifts, arms. You get the arm lift or a brachioplasty.
How do you do that? Where do you tuck the scar? Give me
the trade-off
visual here.
With surgery after weight loss is always the scar.
Sure.
And it's a big part of that conversation with the patients. We're removing your extra tissue, but there's a scar. And so for the arm, you think about it, the scar has to extend in the entire area where there was the laxity.
Yeah.
So if you have laxity from here to your elbow, then your scar extends, usually in kind of this inside part of your arm, all the way from your axilla to your elbow. Now, if you only have a small amount of laxity up towards your armpit, we can do a shorter scar surgery.
Yeah.
But most of the time, there's laxity the whole extent. So you have to decide as a patient, what's more bothersome to me, a scar or contour? And usually patients appreciate the better contour more than they do the scar. Ultimately, I think it's a little bit less eye-catching, and then functionally there's less problems with rashes, with clothes fitting properly, and they feel better getting into tighter clothes and then getting into the gym to then help build muscle, which is where we want them to be. But we also do tummy tucks for weight loss. Again, this is not just for mommy makeovers. It's for weight loss too, men and women.
Right.
If you stretch out your
men
tummy,
too are doing this, right?
Absolutely.
Yeah.
Yes, this is not just, tummy tuck is not just a surgery for women. Yeah. If you have laxity all around the backside, then we extend that incision and we do a whole lower body lift. And so it's essentially a tummy tuck plus your back as well. Those scars hide in your underwear lines. So they're very well tolerated.
Right.
For the thighs, we do thigh lift. Those scars are on the inside of your thighs. And these are kind of the main core surgeries for weight loss patients. Now, something that's really important in getting back to overall holistic wellness and health, how do you prepare for surgery like this?
This is a good part of the conversation. I'm glad you said it.
one of the problems, and I know you'll agree and you have a lot of evidence to support this from your work, is that when people are going through a rapid weight loss journey, oftentimes they're losing muscle mass and they're losing protein.
That's right.
And they're not paying enough attention to those things.
Right.
There also frequently are vitamin deficiencies as well.
Yep.
And I am a safety first physician. I'm infinitely proud of my training at UT Southwestern. It's the #1 plastic surgery program in the nation. And they drilled into us from day one. It is safety first and then aesthetics next.
That's awesome.
A dead patient is not a good outcome.
That's right. No, at all.
Or just
on any level.
Or a patient with wounds that could have been prevented.
Right.
And so when that weight loss patient comes into my office and I know that they've had a large amount of weight loss rapidly, either from surgery or a GLP-1, I get labs on them and I make sure that I look for vitamin deficiencies. We look at protein and we make sure that they are properly set up to be able to heal a wound.
Wow.
If you do not have sufficient protein in your body, and if you have vitamin deficiencies that are significant enough, you can end up with wounds that end up being disfiguring after surgery. Yep. And our whole goal is to improve your life. So protein supplementation is really important in the perioperative period. I have all my patients supplement protein for 4 weeks before and after minimum.
That's what I was going to ask you. Do you do a prep? I've never heard a plastic surgeon talk about this in the nutrition piece. And what a refreshing conversation, because it's true. I mean, and you obviously are a more integrated plastic surgeon because you're thinking of hormones and wound healing and nutrition and nutrient deficiencies and protein and all these things that is very refreshing. I've not heard these conversations before, so I love it. I can't emphasize enough to people listening, if they're on these GLP-1s or any kind of weight loss journey, you have to replace your amino acids, your protein. You've got to get enough protein. I understand people aren't as hungry and they can't eat as much, but you can get some great essential amino acid powders and all kinds of supplementation to help build. And getting in and doing a little bit of strength training is so vitally important. I can't even express that enough.
It's so important you hear it all the time, for bones and for muscle mass. But what does that mean? Yeah. That means really your overall health, your longevity. It means your ability to heal a surgery as well. These things affect every aspect of your life. And so if you have a surgery and you have really poor muscle mass, you have really poor bone density, this also means that your skin quality is really poor, because your skin is also going to show that poor health, that diminished nutrition status. Yeah. Yes. And so the most that you can do to feed your tissues with good nutrition is going to set up your entire body from your bones up to your skin level for appropriate healing.
I love that you have a 4-week before and after program, before surgery. I think that is amazing. If people listening maybe there's people listening that are planning to do some sort of surgery. We're going to obviously leave all your information in the show description, because, I think it'd be worth it to come have a consult with you. Whether you're local or not. We have patients fly all over the country to our offices. I'm sure you do too.
Yes.
But if there's just a couple of things that you would say nutrient-wise, if somebody is getting ready to have any surgery, what would you say that you normally see as a deficiency, or just a general recommendation of some good supplementation besides obviously the protein and amino acids for wound healing that we just talked about? What other things could people do that are easy, add to their everyday, lifestyle?
These are the hallmarks of good nutrition. One, you need fiber, so you need to eat the rainbow and eat it in whole forms. Don't have it ground down into a powder form. Eat your vegetables in whole form. You need protein. Now, you can certainly supplement protein in powder form as well, but eat it in your food, eat it as a supplement. Those are kind of the no-brainers. Vitamin D is a very common deficiency that we see. Now, it's important not to take too much of a vitamin, especially the ones that are fat soluble, if you don't need it. That's why lab work is important. So get your labs, see what you're deficient in, and then supplement that. So B12, vitamin D, great vitamins that are frequently deficient in somebody who has had rapid weight loss. And then low sugar. So we know that anything that anybody that has a high sugar diet is kind of a pro-inflammatory state. And so I always tell my patients, high protein, low sugar is your secret to success with setting yourself for optimization for surgical healing.
Yeah, that's so good too, because, getting them out of an inflammatory state, or even, trending more towards an anti-inflammatory diet, right? Without all the processed foods, if people could just stop processed foods, I mean, it would do a world of good. I mean, your patient that you said that, decided just to stop Doritos and some of this other stuff. I mean, anything you're putting in your body that has that much chemical is such a toxic burden. It just, it makes me crazy. It's very logical. But also those foods are designed to be addictive. They're hard to get off of.
They were designed.
Yep.
At the lab 100%. Level, they were designed to be addictive.
Yep, exactly. So is there any other thing that, I'm going to have you back because I want to talk about some other, things that we've talked about on the sidelines, like hormones and the relationship with, plastic surgery and skin and all of the things we're talking about. But before we wrap this one up, is there anything else that you would advice you would want to give people, or when they're either going to have surgery, looking for a surgeon, or any general advice?
So I think when you're looking for a surgeon, one, look for a surgeon that listens to you, like we mentioned earlier, and then look for somebody who has gone to a program that is overseen by the American Board of Plastic Surgery. That's really important. That way you know that you're getting somebody who is trained at the gold standard level and who's gone through a formal plastic surgery curriculum, and that they also have a board that they have to answer to when things go wrong. So a lot of accountability. And I think that's a winning combination. If you can find a surgeon that sits down with you, takes the time, you're not just a number in their mill of patients.
Right.
And that has also been trained in a program that is ABPS governed.
Awesome. Well, I appreciate you taking time today. It's a refreshing conversation. I love your approach. I would hope that maybe this is going to be the trend, because I think people are wanting this type of conversation with their aesthetic providers. And it's more, like I said, more of an integrated approach. So I really appreciate your approach and look forward to talking to you again.
Thank you for having me.
Yeah, awesome.